Medicine cure diseases, but only doctors can cure patients. Well said by someone. My name is Nisha Masroor. I am the Corporate Communication Executive. Today, we have a very special guest, Dr. Sudhir Singh, who is an awardee of R.G. Saraiya International Fellowship Award by Association of Plastic Surgeons of India, trained at premier institutions of USA, Taiwan, Thailand, and Australia. Recipient of FIAMS and Kashi Ratna. The first sex change of male to female in Bihar was done by him, and he has been visiting international scholar at Charmgang Memorial Hospital at Republic of China and whatnot. Welcome, Dr. Sudhir Singh.
Thank you.
Sir, first tell us something about yourself.
Actually, you have told many things about me. And just to complete that, my name is Dr. Sudhir Singh, as you told. I have done my MBBS, MS in general surgery, super specialist in plastic surgery from the same institute, that is Institute of Medical Sciences, Banaras Hindu University, Varanasi at a stretch. After that, I worked in Bombay Hospital in Bombay. And for a short period, I went to this USA and worked at Buffalo as Mercy Hospital. Then in Australia, I did a fellowship for aesthetic surgery there. And in Taiwan, microsurgery and craniofacial surgery. In Thailand, sex change surgeries. So number of institutions have gone and have been trained for that. I also received the FHNO fellowship for the head and neck oncoplastic surgery. That is from the Amrita Institute of Medical Sciences, Kochi. And besides that, we do this microsurgery, this liposuction, lymphedema, aesthetic surgery, burns. This is, and recently we are working on the wound care newer technologies like, for example, bacteriophages. That is the virus found in the river Ganges. We are using to cure these wounds which are infected by drug-resistant bacteria. This will create revolution in future.
All right, sir. Although this field is very great, but still, we want to know that why you have chosen this field.
Our parents forced me for joining this medical science. So once we have joined, so by step, you kept on approaching. There was no specific target that I should do that. For example, after doing my MBBS, so I thought I should join the pediatrics, but then came that no, surgery is the glamorous branch, and a surgeon are the most favored people. So I opted for general surgery. After that, I wanted to go to urology. Then they said, you should come into a field where innovations can be done in an extensive manner. Like they say, plastic surgeons are the hallmark of innovations. We treat patients right from hair to toe. So this was a vast field and really I loved it and I'm doing it. If the time passes, we keep on doing it. Nothing is planned like that. But now surgeries are planned. They should be done with a backup plans. That's what I've learned and we are doing it.
Sir, as you are the first one who has changed sex from male to female in Bihar.
Right.
So, sir, share your experience with us that how challenging it was for you. Because along with an achievement, it was also a heavy task.
Actually, this surgery was done in 2008 or 9, something like that, at Patna. So I was called there. And there, that person, I will not name that person wanted a section. It was like, that is a soul in a wrong body. He was a normal person in other sense. So we have a psychiatric evaluation, whether that patient needs it or not. After getting all the legal corrections, then we did the first breast implant surgery. We made a breast so that if he changes his mind, we can remove the implant, silicone implant. And but if once we touch the this genital part, we can't reverse so easily. It can be reversed, but not so easily. Then we were confirmed after 1 year. We did that surgery, and that patient was round about, I think, 52 years old. That is also thing, because he had a full family also. We did, and it was very successful. That was first operation. And I should tell you, after that, I went for the fellowship of sex change surgery at this Thailand, and worked under Professor Precha. He is a world renowned father of sex change surgery.
Sir, as you are the senior consultant of plastic surgery and also you have done lot of cases successfully. So let us know that what are the benefits of plastic surgery and what are the risks involved in it.
There are a lot of benefits in plastic surgery, which few people can imagine. First is, a person who wants to look good and feel better. For that, we have cosmetic or aesthetic surgery. For example, we can do rhinoplasty, for example, crooked nose, for the lip augmentation, for the facelift in the old people, removing the wrinkles, hair transplant, breast implants, breast reduction, breast lift, and liposuction. So there's numerous surgeries are available for that. That's one benefit. Second benefit, which is very important, is for reconstructive surgery. For example, a person is traumatized, he has lost a limb, or he has a crush injury. So there, our role is most important. Without us, all orthopedicians cannot dream of that. For example, we do microsurgery, we do reimplantation. For example, there is a, for example, in the Kochi, from where I have did my FHNO fellowship, they have done the world's Asia's first hand transplant from the dead body. That is a very big achievement they have done.
Sir, that was the very
And that was done by my teacher, that is a Dr. Iyer there. So that's a second great benefit. And third benefit is oncoplastic surgery. For example, in cancer surgery, we remove some part of it. For example, the whole of cheek, we reconstruct by a microsurgery, free flap techniques. And in the burns management, the survival of 90% of burns have is anybody can dream of. Before that, more than 50% burn, matlab patient cannot be saved. Now we can go for 90% because of the recent advances like skin substitute, artificial skin. And what I talked, if we prevent infection, we can cure a patient. And for that, we are doing work on bacteriophages. That's a virus killing drug resistant bacteria. So there are a lot of benefits. See, without risk, there is no gain. We have to calculate the risk. For example, if you want to save a person, there is always risk. But because of advancement in anesthesia and other critical care, that have risk has decreased a lot. And besides that, we are opting for more of a minimum access surgeries like endoscopic facelift. That and we make a scar in a very small area, and then we go to incision in a small area, and then we do the surgeries.
so, sir, as you have said that so much so despite so much risk, why do people prefer plastic surgery?
Because this is a glamour world. It is coming. People want to look good and feel better. And second time, there is more of an exposure. Before that, plastic surgery was not so much advanced, and people used to live a secluded life. More the Western culture, more exposure has been there. For example, a person is having a gynecomastia, that is called female breast in a male person. That person, if he has to take out his clothes to take a swim, he will look very, to him it will look awkward. For that, we do a surgery, that is a gynecomastia reduction surgery. So I want to say it is more of a televisions, media exposures, or social media that has created a very good field for aesthetic plastic surgery. And second, people want it or not want it, they have to get a plastic surgery done for trauma cases, for limb reimplantation, for burns care, for the wound care.
Sir, you are also a member of many medical association bodies like Association of Surgeons of India, the National Academy of Burns of India, the Association of Plastic Surgeons of India, etc. etc. So I want to ask you that how can a journal be a part of these associations? And how does the journal can be helpful for these associations?
Actually, all associations have their own journals because all researchers has to be published. If the progress of a doctor or a medical field is just by what he publishes, even if you do thousands of cases, it becomes a technician job. If you publish a paper, that means you know the things properly and you can contribute in the progress in that field. So the journals have a great role. In fact, we have to publish as many as papers for the progress of that.
Sir, as a plastic surgeon, what do you expect from a journal?
I expect that journals should have a very good peer review. They should have a person who can do a proper peer review, and it should be done blind aspect. There's a two people are involved. I want at least four people should be involved in that, so that the authenticity of the work should be taken care of. And I think the journals should publish some of the communications also. What are the future revolutions which are going to come? And this editorial should be also published of the past researches. That's what I can say for that.
All right, sir. Sir, as you have started Burn Awareness Project under the banner of Lions Club, so what are the objectives of it?
This I started long back when I was the president of one club, and also the burn project we had a coordinator also. However, it's a very costly procedure. So actually, we did many cases from our own fund. Even a movie was also, the documentary was also prepared. But now I am doing my own self. This all charity work on this thing. The objective is to create awareness among the people to rehabilitate the post-burn contractors, especially the Diwali is coming. That time we become more active and tell about the hazards of fireworks. Matlab ki, play with the fire. I don't bother about it, but take care of yourself also. So the objective is to prevention and taking care of the immediate burn. And for those people who have already got the burn, how to rehabilitate them. If they have any post burn in this residual contractures, how to treat them and how to make them work occupation oriented. That's what we are doing.
All right, sir, you are doing a very great job. Sir, in last, I want you to tell something to our viewers and to those who want to move ahead in this field. So, what message would you like to give to those as a senior consultant of plastic surgery?
Plastic surgery, they should choose plastic surgeons who are board certified, who are properly trained. They should not go to the quacks. They are not simple operations. Even a scar removal, it carries a lot of weightage. This is a very innovative field, and this will give you a lot of innovations to do that cannot be thought in other fields. For example, we have skin substitutes, bacteriophages, and many more to come because we are dealing from right from here to the toe. So whoever wants to come into this field, they should not think only of the glamour side. They should think of this research side for the benefit of the mankind, because you have to treat or provide microsurgery services to help those people. For example, if the limb is cut, you can reimplant it. That will be a great boon to the society. These things can only be done in plastic surgery. So I want those people who can give time, because these surgeries take around 8 to 10 hours itself. For example, when we do the craniofacial surgeries, the whole day is gone. For example, when we do free flaps, they also take about 8 to 10 hours. So very devoted persons should come and not think only of money, because for that part is aesthetic surgery or cosmetic surgery. You can make up with that. For these type, you have to give your best. So only those people should come in this field. That's my answer for that.
Thank you so much, sir. Thank you for your time and thank you for this interaction. It was very informative interaction.
Thank you very much. Thanks.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.